Hey guys, so I wanted to talk to you today a little bit about scarring. So often patients will have either a traumatic injury, maybe they got in a car wreck or got in a little scuffle, or maybe they actually had an operation, they had a surgical incision, but the scar did not heal well. And so what are different forms of scarring that we know as surgeons to watch out for? Well, one is something called hypertrophic scarring. And so what that means is the scar will often get wide, it will become very red, sometimes it can be very tender, and often it happens out of the blue. You may have had an incision that healed well and this new one didn't. There are many different forms of treatment that we can do for the patient, such as keloid injections and some massage, some scar gels, scar cream, scar sheeting, things like that. But if a patient has had that happen before, or if you have a scar that you don't like, certainly you can see a facial plastic surgeon. We can look at that scar together and come up with a plan to try to make it look better for you. Something else along those same lines is something called keloiding. Keloiding is a little bit different than hypertrophic scarring. So a keloid will actually grow outside the boundary of a scar. The most common place that we see this is if a patient gets their ears pierced. So if you get your ears pierced, and then these things can grow almost to the size of like a Christmas ornament. I mean, they can really pull down and drag the ear. They can become very painful, and then often, obviously very much a social, people don't like to be seen with these things, and so they'll want to have them removed. Well, what is a keloid? Well, what we have found is that there is basically a genetic predisposition to have a keloid. So very often someone in your family, dad, mom, grandfather, or whoever, had keloid scarring as well. And so if you have someone in the family that has keloid scarring, you're more likely to have it because there is a genetic predisposition to inherit that from your family. Now, the good thing about it is if you have formed keloids, really what that means is you were just a great healer. So you have that, your body actually goes and heals that area much faster than say the next guy or gal down the street. And so at some point along the line, if someone in your family had an injury, it could have been 10 generations ago, but they were able to heal that much better than say the next guy again that had an injury. So this is something that is good. Your body is a very good healer, and we don't know this yet, but as further genetic research is performed, it may turn out that maybe you have less chance of getting cancer and these sort of things because your body's immune system is so good. But obviously because your body's so good a healer, it forms these keloids, and we just don't like the way that they look socially. But from a medical standpoint, they are not causing you any harm, other than, again, sometimes they'll grow and actually pull and become painful. They itch a little bit and that sort of thing. And so certainly, you can have a consultation about having this removed, and we can discuss different ways to basically keep it coming back again. But that's just a little bit on keloids as well as hypertrophic scarring. If you have any of these issues, certainly you can come in, have a consultation with your facial plastic surgeon. Often dermatologists will treat things like this, general plastic surgeons, and so there's a lot of overlap, and we often help each other on patients that have difficult cases or recurring cases. But if you have any questions about that, please let us know. Thanks so much.